Okay, so to enhance safe use of opioid therapy, there are a number of things that can be done. And I think that probably the most obvious is what we've seen with abuse deterrent formulations. And there's all sorts of abuse deterrent formulations. There's ones that if you try to dissolve them, they end up in a viscous solution, so you can't inject them. There are others that are not real snortable, so if you try and crush them up, you get these shards of sharp kinds of pieces that people don't want to snort those. I don't think that abuse deterrent formulations are necessarily the end all and be all. There are some abuse deterrent formulations that if you try to manipulate the formulation, you get release of naloxone and naltrexone, so it blocks it. So those things are all, I think, excellent in helping to mitigate against the risks or the dangers of opioids, but they're not going to make the problem go away. And again, I think it goes back to education. I think pharmacists need to be really astute about what's going on, but not to the point that patients are blamed for doing something that they're not doing wrong. So for example, in certain states we have this thing called the pharmacy crawl, where patients come in legitimate patients come to get a prescription filled and they can't get it filled. And in Florida, for example, they may go to 4 or 5 or 10 different pharmacies and they finally find a pharmacy to fill it, and then they find out it's in a different zip code and the pharmacist says, I'm sorry, the regulation will not allow me to fill a prescription. So, I mean, pharmacists need to be involved so there's a safe distribution of these opioids, but they need to be really keen about what to look for. And in large part, I blame the schools of pharmacy, medicine, and nursing for not doing a good job. And when you think about it, in all these schools, we spend a lot of time teaching about cardiology and diabetes and hypertension and cholesterol. And all those things combined, there are less drug deaths a year than there are from opioids. And there are far many more patients that have chronic non-malignant pain than there are with all those disorders combined. So it begs the question, why are not the schools spending more time teaching about this? And that's a huge part of the problem.